Hello, I'm David Gross, and today I'll be leading you on a path of discovery. We'll be exploring an aspect of life that can be hard to face up to, and oftentimes leads to very challenging questions. As we progress in years, there usually comes a time when we're unable to meet our own needs. We need some assistance. We may have family we can count on, but oftentimes the level of help required goes beyond what family can contribute. This change from total independence that we've become so used to can be scary, and no one likes that feeling of helplessness. So, to aid you on your search for what may work best for yours or your loved one's situation, we've brought together a panel to ask questions to help shed some light on the matter. We'll hear from an actual family physician, getting his thoughts on this, and find out from a professional and medical standpoint what you should be considering. We'll also hear from Emily Chambers. She has an elderly parent who's having more complicated medical issues than she can handle. Also, we'll be checking in with William Ferguson. He's spoken with his physician as well as his family, and he's in the process of selecting a home with the skilled nursing care he's looking for. We'll get his all-important take on the matter at hand. Along the way, we'll hear from the care partners at a local elder care home to see how they address the issues brought up by our panel. Now, without further ado, let's go to our local physician.
In my opinion, whenever you're looking for a skilled nursing facility to go to, there's certain things that you do have to look for. For instance, let's say you just had a hip surgery or a knee replacement and it's something that's planned and you know that you're going to need some rehab. That's exactly what you do, is you take a look at wherever ideally you're going to get the best rehab. You want to look at a facility where they have multifaceted care. They might have the facilities to help if that memory reaches a point in its decline where your loved one might need help with those what we call activities of daily living, which would include bathing that individual, helping that person with their dressing every day, getting their clothes on, helping with personal hygiene, helping with making sure that their dietary intake is appropriate, and helping with meals. You would also like to see a nursing home where if you're walking through, the residents of the nursing home are up and about as possible. They might be in wheelchairs, they might be rolled from one place to the other, but it's nice to see them going to activities, it's nice to see them taking part in a variety of different things, because that tells you that that nursing home has truly taken a vested interest in trying to get that person a good quality of life. And that's probably one of the most important things that you'll see.
With those medical concerns in mind, let's check in with some staff members, also known as care partners, from a local elder care home, West Haven Manor, to see how they meet these all-important medical needs.
West Haven Manor is a 177-bed skilled nursing facility and 70-bed personal care home. We provide skilled nursing services such as speech, occupational, and physical therapy. We do IV therapies and other skilled treatments. We also provide a continuum of care through having both the skilled nursing home and the personal care home on the same campus.
We have personal care and we have skilled nursing. The skilled nursing, we offer therapies of PT, OT, speech. We also offer hemodialysis, wound care, IV therapy, hospice, respite care. We also have a very good activities department. Over at the personal care, we have an adult daycare and we have a dementia unit.
We provide services from the outside community. We can get x-rays, labs, we can have specialty physicians coming in psychiatry, podiatry, and trying to decrease the hospital readmissions back to the hospital.
One of the conveniences we have and things that we provide is the continuum of care. So if a resident needs different levels of care, meaning skilled nursing versus personal care, being on the same campus, we do have the ability to help residents in that way. They can go back and forth between the two buildings, get the level of care they need, remain on the campus, and it's important, what it's called in the industry is aging in place, because you don't change their environment so much. They're with people that they know, familiar with the staff and other residents, and they remain comfortable while receiving the level of care that they need.
Our electronic medical records here provide where all departments can easily access to the best care for the residents. Dietary, all the different departments, they can see weight losses, they can see wound care. It's right at your fingertips. All of their information is entered into the system by the nurses on admission and by the social services in the different departments. Enter all the information on the resident.
Another thing that we do here at West Haven that's helpful to making sure that our residents achieve their goals is that we have 7-day-a-week therapy through Blue Sky Therapy, and this allows us to make sure that we get more residents to home. Here at West Haven Manor, over 50% of our residents who discharge to a lesser level of care.
Our physical therapy helps with ambulation, walking, after someone's had a knee replacement or a hip replacement. It helps them rehabilitate, get them back into the community faster. Our occupational therapy helps with the upper extremities and dexterity, and our speech for swallowing and speaking after a stroke are all specialized departments that we have here.
While the medical insight is so important, we can't forget about the loved one's family and the questions that they have. And for that, we turn to Emily Chambers.
My name is Emily. I'm here to share with you a bit of what I've been going through with my mom. Let me start by saying that my mom is my best friend. She came to live with me about 2 years ago. She moved in when things began to get a little difficult in her everyday life. I saw that I could help her with some of the basic necessities, and it was great. But then Mom began forgetting things. At first it was minor, and you could just chalk it up to old age. But then I began to notice patterns of forgetfulness, and it became more serious. She would forget to take important medications, or not know where she was for a minute, and even have trouble coming up with her grandkids' names. So we went together to visit her doctor. And that's when they told us that she was in the beginning stages of Alzheimer's. Much as I would want to be the one to take care of my mom, I know that she was going to need a whole lot more than I could do for her. Now, I'm not the kind of person that can just give up and put their mother in a facility and forget about her. So I made a list of concerns that I have that I need to have addressed before I'll allow her to move into a home. I need to know that the people that work there, the nurses and the other staff, will care about my mom, will listen to her and spend time with her. I need to know that when I go there to visit, I'm going to feel welcome and like I'm just going over to Mom's place rather than to some sterile hospital-like setting. I'd like to know that she can go outside and still be in a safe and secure environment. I need a place where even though I'm not with her, I know that my mind can rest easy and that I don't need to worry about her constantly.
Ms. Chambers' concerns are real. Let's go back to West Haven Manor and visit not just with the staff, but with an actual resident to see how their home might meet Emily's criteria.
The Quality Life Services homes are adopting a philosophy of caring known as the Eden Alternative. The Eden Alternative enables us to transform our institutions into environments of home, where those who live there have choices in their care and their routines, where those who live there suffer no more from loneliness, helplessness, or boredom. They have meaningful, purposeful activities to engage themselves in, and we're building relationships with residents and residents and residents and staff and staff and staff, and that's truly the foundation for all of the aspects of change that we undergo later. But once you build a relationship with someone, you begin to care for them, and ultimately those residents receive better care.
With Eden Culture Change, the purpose is resident-centered care and getting away from the traditional medical model. which means we do try to provide a sense of home. We want this to be their home. And in doing that, we want them to pursue the activities and interests they had at home here at West Haven. So we do everything that we can to help them achieve that.
We try to incorporate not just on a medical viewpoint for the resident, but for a neighboring family bond between the resident, the staff members, and the families.
The staff here is lovely and they're very good to me, and I enjoy it. It's home to me. That's the way I look upon West Haven.
The people here, they treat us very good. And the aides that take care of us, I've never had one aide in this place that has been mean to me or even said a cross word to me.
We offer care conferences to all of our residents and their family members. The entire interdisciplinary team is involved in those care conferences, which means that you have representatives from therapy, dietary, nursing, basically all aspects of their care. It gives the family members and the residents an opportunity to be involved with, ask questions, and provide direction in the care of the resident.
We always are trying to bring the patient or the resident up to their highest level of well-being, where their life is the best that we can provide. Pain relief, wound care, happiness, their mood, everything, all the way around. If they have no family, then we're the family.
Our final panelist of the day has an important view of this whole situation. He's William Ferguson, and he's looking to put a plan in place to help him move into a home when the time comes.
Hello, I'm William Ferguson, but my friends call me Bill. I'm 76 years old, but I don't feel a day over 75. I was talking with my son the other day. He lives out of state, but he came up for a visit. I told him that some things were getting to be a bit troubling for me, and I might need a hand from time to time. He told me he'd get me a butler named Jeeves. I said no. I was serious. I think maybe I better check out my options from here. Now, I'm not too proud to admit when things aren't what they should be, but I'm getting up there, and I gotta know where I'm going. But I also want to make sure it's on my terms. So here are Bill's terms. I want to make my own decisions, like having a choice of what I'd like to eat and when. I want to be surrounded by people who like to do what I like to do. I want to be involved. I don't want to be alone. And I also want to know that I can afford to do these things. I haven't been a burden to anybody for over 60 years, and I don't see why I should start now.
Bill knows what he wants. Now let's see what West Haven Manor has to offer him.
The residents direct all types of their care, or all directions of their care, and activities is not an exception to that. Basically, activities can be scheduled, such as bingo and different events. It can also be impromptu, meaning if the residents say they want to do something, then the staff helps make that happen. If they want to play board games, if they want to go on an outing, in short notice, we can help them achieve that.
Here at West Haven, we encourage community involvement in the area, the Kiski Valley area. We go on outings, we take them out to lunch, dinner. We have church services that come in and provide that for our residents. We have a lot of families that love to bring in their grandchildren, great-grandchildren to visit with them. During the holidays, they'll have dance recitals that they come here, they dance for the residents. They have all kinds of activities that they really encourage community involvement.
They go on outings. They'll just say, hey, let's go down to Dairy Queen. It was a couple weeks ago, the Dairy Queen down here had a free cone day. And you should have seen the bus loads they would take. They'd take people down, get a cone, bring back, load up the bus again. We have a mini bus. And they take little trips. They go to King's, they go to the little playhouse. And then we have groups that come in. And we have people that bring their pets in. families. We have a lot of families that come and visit and just hang out for a while, sit around and socialize with the other residents because they also feel like it's a home away from home here. It's nice.
I like the activities, especially sit and be fit. And then we go on trips once in a while, which we go to a restaurant, go shopping, go for ice cream. Well, there's a lot of things we do, and I have a lot of friends here.
The activities program here is marvelous. They just simply go the extra mile in that area.
When there is time and the birthday parties are going on, I really enjoy doing that. Just to see the residents, their face whenever they're, everybody sings happy birthday to them, their face just lights up. It's nice.
They do have a lot of things to do here. We don't sit still very long, and when we do, I work puzzles or do something, I can't sit still. I've got to be doing something, and it's a good place to be doing things.
One of the things I really like about here is I have people around me. I'm not alone, and I do get my medicine on time, and I don't have to cook.
We have a lot of elders with diet concerns, of course, but here at West Haven we have a very liberalized diet program where we do, of course, watch for our elders' concerns with diabetes and maybe a heart condition.
We started a 24-hour dining program, and what that allows the residents to do, once again, is have choice. Now, that doesn't mean that we don't follow their dietary orders as given by their physician, but it does give them more choices.
We do have a dietitian, a consultant dietitian here, 3 days a week on average, who does oversee all of the menu planning and, of course, all the nutritional data. So even though we are a little liberalized, we are still within our constraints.
I don't want to stay with family, because you lose your independence, and I like my independence. So that's why I figured I'll stay at West Haven. I like it, enjoy it, and everybody's kind and nice.
I hope we've covered topics that are relevant to your situation. Our goal today was to shed some light on the process of selecting the right nursing home by looking at real concerns from varying points of view. Thanks for your time. I'm David Gross. If you're interested in learning more or touring a local home, then go to www.qualitylifeservices.com or call West Haven Manor at 724-727-3451 to schedule an appointment to take a tour.